Our final presenter is Laura Laws, who will be presenting the team's project, Syphilis Testing Has Never Been So Sweet, a glucose-based point-of-care syphilis test.
What do Al Capone, Oscar Wilde, and 61,000 babies born in 2021 have in common? They all died from syphilis. Syphilis is a sexually transmitted infection, and while we often associate syphilis with being a disease of the past, many high-income countries like the US, the UK, Canada, and Australia have all experienced a massive resurgence in syphilis cases since the early 2000s. Despite syphilis only requiring one shot of penicillin to treat, transmission is still rampant. The convoluted diagnostic system means patients have to wait up to 6 days to hear their results. Point-of-care tests are a critical next step to eliminating this wait time, as they are diagnostic tests that are portable and can be performed on the spot. To diagnose syphilis, you must take 2 tests. The first visual test tells you if you have ever had syphilis and is available as a point-of-care test. The second measurable test tells you the level of infection, whether you have a current active infection. However, this test is subjective, difficult to interpret, and must be performed in a laboratory by a trained professional. We propose the development of a point-of-care test for this second measurable test so that we can not only diagnose, but also treat patients in a single 30-minute consultation. When your body is fighting an infection, it produces proteins that can bind specifically to whatever bacteria is causing you illness, like magic handcuffs that only lock onto a criminal's wrist if they match the wanted poster. Our tests, these proteins are called antibodies, and they circulate through your blood. Our test will take a drop of blood from a patient's finger prick and add it to a test tube. This tube is filled with beads coated in syphilis-like molecules, so that antibodies from a syphilis-infected patient will bind to these beads. Once bound, a new protein comes in and binds to the antibody. This protein is an enzyme that can break down the chemicals in the test into glucose. This glucose can then be measured by a simple $40 personal glucose monitor, also known as a diabetes meter. The meter will give you an easy-to-read numerical value for the glucose concentration, proportional to the concentration of syphilis antibodies in the blood, which can tell us if you have an active syphilis infection. For underserviced populations in both low and high income countries, it can be difficult to track down a patient and inform them of their diagnosis. Some communities have reported that as little as 10% of patients who are testing positive are getting treated. By using our test, we will be able to connect patients to treatment on the spot, which could improve cost effectiveness of testing by 10-fold. By using our test in conjunction with the already available point-of-care visual test, we will be able to eliminate the need for sending any blood work to a laboratory, reducing the burden on healthcare facilities and ensuring that we never lose another positive patient to the gaps in the system again. Thank you.
That was good. That was a good wrap.
I just made
that
it.
was. You wrapped it right up quickly. That was perfect. Okay, now you can take some questions from the judges.
Well done, thank you.
Thank you.
So where is this at the moment?
Yes, so we are in the idea phase. We pitched this idea to a different competition back in January. We are still awaiting those results. And if we are a successful applicant, the next step will be successful applicants from that competition will be paired with grad students that will take on these projects in labs to take the research and development forward. So yeah, we're in the ideas phase. We have met with the Partnerships and Innovation Office to discuss patents. However, they advised us that we should wait until more data is collected before filling out a provisional patent application.
That was going to be my question, is that going to be your question too? Apparently you already asked it. So what's your next step in terms of validation, and what sort of data would you need, and will you attempt to collect for that validation?
Yeah, so we would need to obviously prove the concept in a lab. It's based on sound principles that are really common serological techniques. So the next step, would be going into a laboratory and testing out the principles. Because it is a quantitative test, we would have to create standard curves to determine what the glucose concentration threshold will be to determine active infection. And then we would also look at the specificity and sensitivity of the test, specificity, to other pathogens that infect the blood, whether it's impacted by autoimmune diseases, stuff like that. And looking at the sensitivity, what titer of antibodies, what concentration of antibodies in the blood can our test detect?
I get the last question. So I guess my question is around, the design of the system is, and the way that you've presented it is, a patient would go into, a medical center, into emergency, or see their family doctor. What is the stability of the antibody testing system? Because there's sometimes a barrier to healthcare is just the fact of just accessing it or going someplace or going into a hospital. Is it possible to have a system where you could test at home and then put it in an envelope and mail it and get a result?
Well, so that's the beauty of point of care testing. It's designed to reach these communities. So there are a lot of programs already out there for reaching underserved populations. Mobile clinics are basically clinics, mobile laboratories. There are also, clinic with a K. And then refugee camps will have things like that set up. And then the government of Canada also sends point of care tests up north to remote communities, and they can perform the test within themselves. But it'll be a simple test that doesn't need to be performed by a professional.
Seriously, if this doesn't pan out, you have a career in TV and wrapping things up really quickly. That was amazing, Laura. Thank you.